Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. For anyone who doesn't know who I am, I'm a UK-based consultant audiologist and clinical ear care specialist. I specialise in the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance disorders, and as a clinical ear care specialist I obviously specialise in the removal of impacted earwax, foreign bodies, discharge, dead skin from the outer ear canal. We have a client here who attended with bilateral, fully occluding earwax. This type of earwax is the worst type of earwax. I really don't enjoy this type of wax. It's what I refer to as a clay type of wax or thick mud consistency. The reason for that, it's very difficult to suction. It's also very difficult to remove using Jobson Horne, so an ear scoop, because with that you will just slice through the wax, similarly with an ear hook, and sometimes with a Jobson Horne, when you're trying to get in behind the wax and bring it forward, you squash it against the canal wall. This makes it a bit more difficult to remove. Because of the consistency of the wax, obviously you can't use forceps to remove this because it's just way too soft. So immediately I put some olive oil drops into the ear, and olive oil drops are a godsend really. It's something that I discovered a few years ago with this type of patient, with this type of wax, and it's something that I just thought, let me just use the drops during the procedure as opposed to sending the patient away for a week or a few days. And it's really worked well, and it's something that I teach all the delegates who attend our Clearwax endoscopic ear care course. I suggest using drops as frequently as required really, just as long as the patient doesn't have a perforation or a previous allergic reaction to any of the drops. And what olive oil earwax drops does for me during the procedure, it binds this wax together, it gives it a different consistency, a different texture, which enables me to remove it. If you've been watching my videos, I always make the comparison to an egg, which can bind a fish cake recipe, all the ingredients, or a potato cake. It binds the wax together and it enables me to then get a good suction grip and remove the wax in large plugs. And you'll see that, and you've probably seen that in the thumbnail, 2 large plugs were removed. Other drops like sodium bicarbonate drops can sometimes also bind the wax together, but generally speaking, sodium bicarbonate earwax drops, it makes the wax into a molten consistency, almost like a liquid state. With hydrogen peroxide drops, it actually makes the wax even more mushy, even more into like a wet clay mud type of wax. So it's counterproductive. Hence why I really do endorse olive oil drops. I also endorse olive oil drops because they're slightly acidic, and the acidity helps because the ear itself is also slightly acidic and earwax itself is slightly acidic. An acidic ear helps to inhibit certain bacterial and fungal growth, so olive oil can help with that. There's no water in olive oil drops, and water is kind of, for me, the arch enemy of the ear. And the oil itself, if you use it as a preventative measure, so once you've got your earwax removed, and I'll just quickly go back to the procedure quickly. You can see I brought this wax to the entrance. It's such a large plug. I'm just trying to wriggle this through, and it's self-explanatory, so you can continue watching that whilst I'll explain more about olive oil drops. So if you use it as a preventative measure, so for some patients who I know who suffer from chronic earwax impaction, I say use olive oil earwax drops once a month, and 1 ear per night, and it'll make sense in a moment as to why I'm recommending that. So just say you're cleaning out your left ear using olive oil drops. You tilt your left ear towards the ceiling and you fill up that ear using the olive oil drops, and you let it soak for 5 minutes. After 5 minutes you have to drain it. If you don't drain it, what will happen? The wax will get soft, gooey and runny, and it will trickle down further towards your eardrum, and it will then stick on your eardrum. That patient's eardrum, you can see it's very healthy. We're just on the patient's opposite ear, the contralateral ear, so I've just put some drops in straight away again, like I did for the right ear. So this is the left ear. So after you've soaked it for 5 minutes, you drain the ear, let the oil seep out, and the theory is if you've got a little bit of wax in your ear, that olive oil will soften it enough, and then when you tilt your ear to drain the olive oil out, as the oil seeps out, so will the softened small piece of wax. Obviously, if you've got a substantial amount of earwax already in your ear, it's not really going to drain it that way. It's not going to help rinse it out. And you drain it for 5 minutes. So when you drain it, you tilt that ear towards the floor this time. So gravity, make use of it, put a tissue underneath, allow the drops to escape out of your ear. If you do the opposite ear immediately afterwards, when it comes to draining the opposite ear, the first ear is again facing the ceiling, and you run the risk, if you didn't drain it properly, some of that oil and wax trickling back down your ear. So I always say do one ear per night, 5 minutes soak, 5 minutes drain, and do that once a month. And that's on average. Now, there's some patients I can say, well, do it once every 2 months. There's some patients I recommend do it every 2 weeks, and it just depends on those patients and if they really they secrete wax at a really quickened and heightened rate. So just for the left side, you can see this plug of wax is coated with dead skin. You can see the skin, it's a glossy texture. It's at the base of this plug of wax at the bottom. The patient has got a slightly narrow ear, and this wax is lodged, this plug of wax is lodged beyond the first bend, but then also beyond the second bend. So everyone's ears, or most people's ears anyway, you have an S-shaped curvature of the ear canal. And I believe, I've never been taught, but just using my audiological knowledge, that the reason why we've evolved to have an S-bend ear canal is to help protect the eardrum. So if you do have a foreign body that enters the ear, there's not a direct line of sight towards the eardrum, so it provides some protection, it meanders. I also suspect there's probably some acoustic benefits as well, because when there is some curvature, it does attenuate, so reflects certain sounds, and it can amplify other sound waves. So I'm pretty sure it helps amplify certain high frequencies. The high frequency sounds, between 2 and 4 kilohertz, I would say, or 1.5 to 3 or 4 kilohertz, they're the consonants, they're the beginnings and endings of words, and they're the sounds that provide us with the clarity in speech, whereas the low frequency sounds, this is generally speaking, the low frequency sounds, they're the vowels, and the vowels provide you with the volume, typically speaking. So having, so the folds and creases of your ear, for example, in the external part, they're not only amplify high frequency sounds for acoustic reasons to help you, give you more definition and clarity in speech, but also they help you localize sounds, and so you're able to distinguish between sounds coming from in front and behind you, the folds and creases, by attenuating and amplifying the high frequency sounds. So they're the plug of the wax from the left and right ear. I hope you enjoyed that, guys. I know a lot of you enjoy when I talk about different things in the ear during the procedure. That procedure was pretty self-explanatory, just putting drops in, wriggling out the wax. So I hope you didn't mind me talking about the use of drops and some of the acoustics of our ears. Have a lovely evening, guys. Speak to you soon.